Okay, everyone, welcome to first time. We're talking to a lot of you here in 2023. Thank you all very much for joining for the discussion today. We're going to be diving into the top 7 member actions that are driving ROI for health plans this year. Really, we're wrapping that concept around a bigger discussion of what are we doing as health plans on the engagement front? Why has this become such a forefront topic? And what are some of the tactics that we can use to really move the needle, not just in feel-good ways, but in ways that are actually going to have a financial return for us. So I know we've got a lot of different people on the line coming from a lot of different backgrounds, but really our focus is on sitting in that member engagement seat, and we sort of all play a role in that. How can we all be doing our best on some of these actions, and having as many members from our membership getting to places that they can really be driving their own costs down, their own satisfaction up, which of course we know are the yields for us as a business. Now, if you have not been with us in the past, my name is Drew Corbett. I sit in the product innovation team here at Clarity. I've really spent my entire career in healthcare strategy, and the lion's share of that time in member engagement, member experience type of roles, both in a consulting capacity as well in industry, having spent a lot of time with member engagement platforms and really understanding members and health plans through that lens. So I bring that skill set to Clarity as we continue to look at the products and services and softwares that we offer being instrumental to driving member engagement. That's kind of the lens that I look through the world. For a really quick housekeeping, if folks have not been to any of our webinars before, and this is the first one you're coming to, encourage you to check out clarityssi.com. There's a tab at the top for insights. And in the last year, we have had discussions on driving engagement with EOBs, best practices for member guides, how to use data to create really great annual journeys for your membership. So all of these topics around engagement, we've spent a lot of time talking to the market, both clients as well as health plans that we're speaking to otherwise, just about how we can really solidify best practices within our organization. So encourage you to take all the freebies. One other housekeeping item, we're going to have a few freebies here at the end of our agenda today. So stick around for some calculators, some other things that we can do to sort of help brainstorm with you. From an agenda perspective, though, I'm going to give a really brief introduction. I know most people on the phone are familiar with Clarity, either actively working with us or otherwise. But we've also got a lot of folks who are joining for the first time, so just want to give maybe a minute on us as a background. And then we're going to dive right in. What do we mean when we say the top 7 actions to be focused on? How are we kind of defining the ROI associated with those? And how are we going from it's not just a feel good, but there's actually a healthcare economic driver behind getting these things done? Really where we want the rubber to meet the road, though, is, okay, that's great if that's how reimbursement runs or if that's how ROI is achieved. How can I actually do anything about that? So we really want this to be tactical from the standpoint of, as you think about your engagement strategy for members, or as you're thinking about some of the communications that are going out to them, what are some of the tips and tricks that you can use for each of these 7 measures to help be a little bit more effective? We have a lot of content today, so I am going to move fairly quickly through it, and know that this one also will be recorded, so absolutely have access to it hereafter, but a lot to get through and want to make sure you guys see all of it. So let me first start just with who is Clarity. So Clarity's SaaS products and our best practices are really intended to optimize what I would call traditionally check-the-box healthcare communications. Our mission is to transform those communications into engagement touchpoints. Because if we do that, then we're generating a return on investment. Every time we touch a member, it has the opportunity to either just be sort of a latent dead communication, or it has the opportunity to nudge that person into an action that is going to increase his or her state of health. the more often that we can be doing those engagement opportunities as opposed to just a communication piece, the higher the ROI for you. So our whole mission is to help drive that ROI through traditionally that print modality, which has been check the box in the past. And the reason that we're in a great place to do this is I would argue over probably most of the other vehicles, vendors, partners in the supply chain of member communications. We probably touch as many of them as often as really anyone in the industry. So Clarity has created and distributed over 150 million communication touch points specifically for health payers in a given year. So when we think about all of those things that end up in a mailbox, whether that be a new ID card or an EOB, hundreds of millions of opportunities to really look at those as marketing and member communications that have the chance to drive and nudge member action. So we've really found ourselves in this seat of, so many of our clients have said, we've got beautiful emails and great software to run those emails, but we've only got a 10% email list. Clarity, as a complement to an email and multimodality strategy, we've got 100% of the addresses that we're sending to within your membership. We're actually arriving in front of those eyeballs. And so we think about the communication opportunity. It's really why we have become such a valued partner and not the only arrow in the quiver when we think about engagement communications, but a really valuable one that is getting more and more valuable each year. So for purposes of today, we're talking about member actions that drive ROI. And ROI is very easy to sort of say and feel good that you're creating value. But until we actually get specific about it, it's just sort of a fluffy term. And so we want to spend time on how ROI is defined for purposes of how we look at it. We're going to look at are things either specifically associated with a star measure, a HEDIS measure, a CAP score, something of that nature that's driving reimbursement. And then we're going to look at, do these actions have a wide net over the entirety of a membership? Hundreds of thousands or millions of people have the opportunity to participate in this action. That's really valuable. At the other end of the spectrum, actions that are really, really high unit value. And so I'm starting to put someone suffering from multiple complications, comorbidities, those people who are in a really sick state. One action from one person in that camp can also have a huge unit value, which is another place that we'll focus on of really digging into folks that we know drive the cost of our membership. Finally, if you just need to take a step back from all of the sort of healthcare kind of nerd stuff that we're going to go through, just think of yourself as a participant in the healthcare system, and the actions that generally feel like they support you at a human level, those generally tie into some of these mechanisms. So at the very least, if we're talking about things like treating someone well, meeting them where their barriers are, all of those are going to have a place in the conversation today when we talk about ROI. But let's get specific. And so if you'll bear with me, here's how I'm going to set up to our 7 top actions. One, I want to go through these things that we're defining as ROI. And then 2, I want to talk quickly about how we're going to give you all tips and tricks on driving those member actions to be participated in at a higher rate. So starting on the sort of health plan economic side, and if I'm thinking about the final rules that have gone in place in the last couple of years on star ratings, the big sort of sea change has been a higher proportion of measures that drive reimbursement are falling into that patient experience, member experience, and access camp. And so if we think about that used to comprise maybe a little over 30%, and we're now well over 50, almost 60%, the place that the dollar is asking us to focus is absolutely on member experience. So these are really worthwhile places to be making our bets in terms of communication strategy. The one other place that I'll point you to is at top right here. The reshaping of the curve of 1-star, 2-star, 3-star, 4-star, and 5-star plans. And if we look at, there are fewer 5-star plans than there have been. the overall average is lowering, and those 3-star plans are getting much, much more. And so if I think about sort of CMS kind of driving that bell curve back, that's what we're starting to see. And if you're asking yourself, where do I fall on that bell curve? Am I over the line or am I under the line? That's where some of these measures are having such a huge implication here. So my takeaway is let's focus on being really effective with member experience. And let's make sure that as the sort of star ratings are shaking out again in light of new rules, that we're falling on the high side, that 3.5, 4, 5-star side of the plan. The value on that, just to, I'm probably telling everyone on the phone things that you all know better than me, but the bonus payments associated with that 4 or 5-star plan, that's like compounding your interest. These are the things where you're going to get that extra credit just for being in that state. The other really huge opportunity is that year-round marketing and the ability to be visible for plan recruitment, sort of like plan marketing throughout a greater part of the year. But even if you're down at that 1 or 2-star level, adding a star when you're at that lower end of the spectrum is going to show you an increase in enrollment of 8 to 12%. So no matter where you sit on the spectrum, there's a huge amount to be gained in terms of advancing that 1 star up. And again, things that we all know, but it's helpful to sort of come back to that as a basis for starting a year and creating a communication strategy. Now, what I think is really interesting when we talk about 1 star, 2, 3, 4, 5, it creates the impression that these are sort of like 20% apart from each other, and that a 3-star plan is 20% behind a 4-star plan, and so on. I'm going to be showing some of these things that are pulled directly from CMS, so hopefully I'm saving you a little bit of cms.gov Googling later on, but showing that the difference between performance at a 3 or a 4 or 5-star in some of these specific measures, it may only be 1 or 2% of your population in terms of if you're performing at that higher level. So for example, what we're looking at, getting those needed prescription drugs in our Medicare Part D measure, the difference between a 3-star and a 5-star plan is only 2%. And so this should be a hugely motivating factor for all of us to say, oh, we're 3-star and our competitor is 4-star. It feels so distant. When in actuality, nudging just in some cases a couple of thousand members to take an action can be the difference in getting up to that next star rating. So when I put my communication strategist hat on, I'm suddenly saying, what is absolutely every opportunity that I can use to ask that person to take that action? And that's where we start to get into kind of the how and where clarity is really supporting the market on this stuff. Okay, so that's kind of the end of our preface on, what is ROI, how is it defined, and how are we going to be looking at it today? At the end of the day, we're talking about asking a person to do a thing. And so all of the sort of grandiose healthcare economics, we can kind of park them to some degree, because really we're just reaching a person and we're trying to get them to participate in an action that they haven't taken action in yet. And when I think about it that way, it introduces all of these different behavioral science principles to the conversation. And I'm sort of asking myself, when I communicate with a member, do I use things like scarcity or authority or choice architecture? And it's important because Pepsi is doing that, and Toyota is doing that, and all of these consumer brands that are actually nudging people in the right direction, they're leaning on these tactics. But when I go back to thinking about check the box communications, if we're not looking at every single word and every single sentence with intent and saying, who is the audience I'm trying to reach? What do I know about that audience? And am I using the words on the page to actually be sort of a tailwind with these behavioral principles to get the greatest likelihood of that action being taken? That's where the best performers are going to have conversations amongst their correspondence team that look at a letter like the one you're seeing on the page. And they're saying, what is every word doing for us to advance us towards our mission as a health plan this year, or to get people to take those actions? The alternative, and where we're seeing some plans that are struggling a bit, is they say, we've always sent it out this way. It says welcome, and that's good enough for us. Again, that's completely fine, but it is leaving on the table the idea that these letters, these EOBs, even these 1095s, things like that, they all have the opportunity to nudge. And if we're not using that opportunity, then of course it's one we're leaving on the table. So that's kind of our pitch on that is the value is out there if we're willing to put the hat on to go out there and take it. Okay, so enough preamble. Let's get into what you all came for. What are the actions that we and the health plans we're talking to are really talking about as being the important ones for ROI this year with their membership? Number 7, portal registration. We talked at the outset about how some of these actions, they may have a lower unit value, but they apply to absolutely everybody in the health plan. Portal registration is the perfect one for this. And we know that we are bridge building to a digital relationship with members, and portal reg, and you can almost synonymously say app downloads, depending on what your digital strategy is. That's where we're either making or missing on this. We know that members have higher satisfaction scores when they are logged in and registered to a portal than when they are not. This is kind of, you're in the conversation or you're not in the conversation. We also know that everything else we talk about today is in some way derivative of you've got this relationship and you do exist in that health plan's portal. You can participate in all of the tools that are available for you there. But again, it's not just about kind of the storyline. So this is the same structure you're going to see for all of the 7 that we're going to go through. We're going to talk about kind of the headlines and the story with that particular action. Then we're going to look at what are the specific ROI measures that you could take back to your team and say, look, we can influence, in this case, maybe getting needed care or scheduling appointments or improved customer service. And then we're going to look at some of the tactics that we can use. So if I'm just doing a quick glance at the star ratings that affect or can be affected by portal registration, I know that people are getting more of the care that they need if they're involved in that portal or that app download, because that's where the really elegant tools to schedule care and schedule care quickly, that's where they reside. Similarly, in terms of our customer service, we know that that's going to be more connected the closer you can get to those tools. So just right off the bat, we know that there are star measures specifically related to portal reg that we can tackle and take on. Okay, so then let's go back to that kind of like human rubber hits the road side of it. When we think about drafting communications and supporting our clients to do so, and we're trying to drive engagement in portal registration, we can't emphasize brevity and simplicity and achievability anymore. I'm also going to show this kind of rubric at the bottom with a bunch of different tactics, similar to what we saw on the other slide. And every audience is going to be different. Every plan is going to be different. Regions are going to be different, and products. So it's just kind of a high level. What are some of the tactics that we typically see as being effective here? But leaning on things like urgency, like there's free value here, authority, and pulling in a stat like we looked at on the last page of you're more likely to have better outcomes, a greater sense of satisfaction if you join this, hey, click here, or go to this website or scan this QR code. Those are all the tactics that we might be looking at pulling into a letter. High value action number 6. And we actually saw a reference to this on one of the previous slides, but we're looking at well child visits and perinatal care. And part of the reason we're doing this, again, is that we've got specific HEDIS and CAPS measures are where we're going to focus this time. But we also know that there is such a long tail to people not getting well child visits in those first 30 months of life, as well as perinatal care during mom's pregnancy. So some of the stats here, especially with regard to cardiovascular events, can be a really devastating cause of maternal mortality. trying to get into the prevention of some of these things that we know are then going to have a very long tail cost, as well as just a terrible experience for our membership should some of these things go neglected. The other piece of this is you never have a second chance to make a first impression. If we've really engaged members in a human way across a pregnancy and then early in that child's development, that is a really rock solid place to look at low attrition, and having someone sort of have that member for life mentality, because we've always done it this way and it's always been great care for my children. That's a plan and a brand that I'm probably going to have a really strong association with. So that's kind of the soft side of it. But as we look at, again, some of those HEDIS and CAPS measures, we can specifically say on the HEDIS side, for example, that a well child visit within the first 15 months, and then a well child visit in 15 to 30 months, those are specifically going to be questions that are asked when we think about that overall HEDIS score. So when I start to put pen to paper on a correspondence, and it's why are we doing this? We know the business reason why this is an important measure to push. Similar, I'm sharing some of the CAP survey questions on, was it easy to get necessary care, test, treatment for my child? We can write our correspondence right back into that question. And we know that when that member is presented with that question, if they are someone who ends up taking a CAP survey, that not only have we provided the care that supports that, but we've also communicated around, we're specifically trying to help you here. So getting more into that usually and always response, as opposed to that never or sometimes response. Big dollars doing that over hundreds of thousands of people and doing that over the course of the year. So if there are any parents on the line here, you can imagine receiving this, call it your enrollment kit, or receiving a letter or receiving an EOB when you're in that family planning stage, or when your family's in the middle of a pregnancy, and what might be valuable to you. So one that I really like to start with here is that sense of endowment of, there is already a whole suite of resources here for you, and they're sort of yours for the taking. And so there's no ask, there's really starting with a give. Another I like to point out on this slide is the literacy level. We know that many people may not have been active participants in their care for themselves as an adult. But when there is a forthcoming child, or when they are new parents, there's suddenly a different sense of wanting to be involved for the sake of that child. And so making sure that folks who have either never been engaged in the healthcare system, which can be correlated with literacy, making sure we are especially conscious of meeting them where they are, can be a really nice opportunity when we're focused on perinatal and well child. Similar with peer pressure, there are so many opportunities where we look at other moms are doing this, and the results coming out of that. I mean, the stats just around the well child checks, I think, could be really great content in some of these correspondence to say, this is kind of the way to go. This is how all new moms feel, and this is the resource that we can apply with that. But it sort of creates even a sense of community out of that peer pressure. And finally, one-to-many value. So knowing that at least we have sort of two constituents here, but oftentimes this can be a way to bring an entire sort of roster of dependents under a subscriber into the healthcare system, and to getting sort of better value for their health plan membership. Okay, high value action number 5, emergency department avoidance. Interestingly, avoidance is an interesting sort of action to take. I mean, we really know about ED avoidance from the standpoint of, man, we're trying to get people to do anything but go to the emergency department in the event they have things like sniffles, flu-like symptoms, etc. And I think this is kind of best captured really from a headline standpoint in a study done by United Health Group, looking at $32 billion in costs from 18 million avoidable ED visits in a given year. And again, we're talking about the avoidables. So of course, the car accidents, the strokes, the heart conditions, the gunshot wounds, all of these should be in the ED, but we're purely looking at added cost from the sort of bumps and bruises and sniffles and things that we could be looking at in other care sites. So again, no surprise to anyone on the line here that this would be something that we absolutely want to focus on, because there's such a lightning rod of attention, I'm sure even within your own organizations, of, hey, how can anybody contribute to a reduction in this cost that we're feeling here? And we know we see this again from the standpoint of sort of like take the back door on this one. Are people prepared with tools that they can use to get needed care? And I'll emphasize on this one, the STAR measure of getting that care quickly. Oftentimes it's a perception that getting care takes too long that is driving people into an emergency department, whereas the ability to maybe quickly use a telemedicine or a different technology can give that perception of, oh, this plan actually does help me get care as quickly as I need. That also means I'm not going to end up at the ED for some of those lower acuity things. The HEDIS measure as well, just looking at what the emergency departments, the visits were during a given year, and looking at a risk adjustment on that if we were to really get into it of, has there been appropriate utilization here? When we look again at putting pen to paper, this feels like one of the most resource-rich opportunities, because there are such great technologies that have effectively become table stakes within health plans. We think about urgent care and the availability of those. If we're in a setting where even urgent care is something that's not easy to access, telemedicine, nurse lines, chat with a doc, chat with a pediatrician, all of these things are increasingly becoming tools that you all have to offer. And so when we present this in the context of, man, it was really tough the last time you went to the ED, wasn't it? Because we know how long that can take. But providing that ointment in terms of convenience to those people. And so recognizing that, just framing this from the standpoint of, the ED is not the best experience you can have. Let's do that from your couch next time, or let's just drive down the road to the urgent care next time and really meet that person where they are. So again, on the framing of this in terms of the convenience of the way you did it versus the way you could do it, repetition, because we know that this is something where if we get people in a habit of emergency department utilization, it really is a habit, and that becomes the default of where care is received. So really quick plug for using EOBs to talk about this. If we know on an EOB that site of care was within an emergency department, but the actual diagnosis code, for example, was something that was pretty low acuity, man, every time one of those goes out, I want to be putting a message out there that has greater urgency, greater value, maybe specific barrier acknowledgement, so that we know that person is actually receiving the message sort of in conjunction with the utilization that we're trying to move. High value action number 4, finding a primary care provider. If we were live audience, I would probably do show of hands after we said app download or portal registration. What is the action that most people are focused on after that? It's almost invariably primary care provider. And we know this, again, similar to the digital relationship established with portal registration, that in-person relationship, or just having that one touch point with a primary care provider, feels like the gateway to participating in the system in a healthy way. All of a sudden, all the lights go on, both with the member as well as with health plan systems of, here's how we can coordinate care to get to these people. But it's got to start with, we just shake their hand and see them in person. And so identifying that primary care provider becomes really important for that reason at kind of a human level. We also know that this is a place where there are definitely perceived barriers of, well, it's going to be hard to do, or that sounds hard to schedule, or I don't know how to pick a good PCP. we can get in front of those things. And some of the stats like you're looking at, even just including the name of somebody who's in network, can drive lift on setting that first appointment by up to 30%. So little ways that we can have personalization can end up with a really outsized participation rate. Okay, so let's think about that. 30% increase by doing something relatively simple, of putting that within a correspondence, getting that PCP's name in front of someone. And now think about some of these measures on the star side. And if we looked at a 30% increase in likelihood that someone takes that first action, can we fall into some of these star measures that have razor thin differences between 4-star and 5-star, between 3-star and 4-star? You start to connect these dots and it's, man, we can do little things on a communication side. And I bet we can bump up our annual flu vaccine uptake. I bet we can start having a conversation with everyone that has that first interaction with their physician of how do I reduce fall risk? Because if I'm sort of going behind the scenes of this fall risk measure, the calculation on this is actually just that the clinician had the conversation with the member. That's what we're looking at grading as a criteria. So this isn't even going into the home, assessing environment, anything like that. Just getting people in front of those physicians who we know are going to be going through these questionnaires as part of doing sort of patient onboarding. We're having a great opportunity to sort of nudge our numbers up just a little bit with each of these. So super, super important. Again, this is where almost every health plan is saying, if someone doesn't have a PCP identified or they haven't been to that PCP in the last 2 years, that's where we've got to start asking people to take that action. And when we do so, again, some of the places that we can focus, audience dependent and completely dependent on if people are engaged already or not. But one, let's show people that it's actually easy to schedule this appointment. So access and ease. If you leaned on 2 words throughout the entire year, you'd probably get more mileage out of demonstrate access and demonstrate ease of use. Showing people how this can really be empowering. Oftentimes there's a sense of, I think I'm sick or I know I'm sick. And so there's kind of something to hide, but really using this as an opportunity to partner and create a sense of empowerment in that person of, there are so many resources here. If you get engaged with us, we can start to help you feel better, meet that goal, whatever those things are. And last place I'm going to focus on this one is that tech enablement. So, the proliferation of ways, either external partners or even homegrown solutions within health plans of how do you reach a PCP without having to go into the office. I think those can be really potent ways, especially as we start to do potentially some, data cuts on a population's either health history, or if, for example, if you have somebody that's in a much older part of the population and it's just a subscriber, they may not have someone else that is sort of supporting their care. That can be a great place in some instances to talk about some of these different modalities to reach them. High value action number 3, another one we are hearing about truly every time we're in member engagement departments within health plans, is driving mail order pharmacy. And I think we're really subject to what the landscape has been in not just healthcare, but in the world over the course of the past few years, and a little bit more of a stay-at-home tendency for a lot of people. But the driver on this is, we know that medication non-adherence is a huge contributor to little issues becoming big issues. And if there are non-optimized medication therapies, that's to the tune of $500 billion in excess costs, all because we just weren't connecting a person to a medication that might have staved off that from becoming so big and so hefty. There is an entire roster of for example, Medicare Part D measures that are associated with this. And so if we're thinking about getting needed prescription drugs, or if we're looking at a particular condition like really high cholesterol, like diabetes, like hypertension, all of these have specific measures that we're going to be graded on depending on if we're getting people the right medications. But when I really think about just what's happened and why this has proliferated so much, one, there's a lot of shakeup in the pharmacy benefits management and partnership world. So I know a lot of health plans out there are sort of reevaluating their PBMs and where people are accessing drugs. But from the member side also, you've got people who, especially in that chronic comorbidity standpoint, they may have gone through COVID thinking, I am not going to go into a healthcare setting. I'm not even going to go into a retail setting. And so meeting those people where they are, mail order has really become the de facto for some of them. But the ones that haven't yet realized how much easier it is, they might be putting themselves into a situation that they're not particularly comfortable with by going into that retail location. So for me, if I'm thinking about being in that situation of I critically need these medications on a daily or a weekly basis, and there's a new way that I can get them, what I'm really breaking is that person's sense of security through the habits that they've built. I know the route that I take to my local CVS, where I park, who I pick it up from, and that feels really safe. And there's this sort of what if fear that might come in if it's, we'll try something different next week. And so one of the places I really ask plans to focus on is this idea of what if mitigation. We know that that's going to be the question or the barrier that we want to acknowledge, and making sure that people are aware this is how mail order pharmacy works. And here are all of the ways that we can make sure that you're getting that prescription. And even if it doesn't show up, okay, what are the routes that I can do to get that prescription within 6 hours, 8 hours? I can still go back to my retail location, for example. Just inserting some of those concern or barrier acknowledgements can really help drive the participation here. And we know, again, going back just to the med adherence side, huge amounts of value just for getting someone signed up for this. We know that we're closing that gap on med non-adherence, which is going to show up in the reduced claims and so on and so forth. High value action number 2. And this one has a little bit of a bonus here. Annual wellness visits, and I'm going to slot in home assessments with that. Just depending on kind of the population that we're talking about. This is really akin to the PCP visit, but it can be a different way to nudge a similar action of, hey, we want to get in touch with you at a human level because there are a lot of different resources that we can connect to you if we just have that 30 minutes with you. You can see some of the stats here on the screen, but the biggest piece of this, I think, is the desire for this connection to be made, but not for what is perceived as complexity or maybe an inability to access that care. So 61% of patients wanting more engagement, and by extension, members wanting that engagement, that is a huge opportunity to say, well, we're the plan that makes that really easy. And doing so in all of the correspondence, again, focusing on ease and access, those are places that we know there is want. And we also know from a payment side, what we looked at up front, that convenience and that positive experience is a place that we're going to see kind of focused on in the CAP surveys. And we're also seeing some of the sort of corollaries in the star rating. So getting that needed care, again, being a principal one. A little bit of a nod over on kind of reading the tea leaves, especially on the Medicaid side or the dual side, is thinking about social determinants of health, or SDOH, and knowing that the risk adjustment around that is kind of a fluid conversation. But the idea that really looking at those in-home assessments, especially as health plans can start to understand someone's broader sort of social determinants and their broader environment. You know, for example, getting into that assisted living facility where we might have somebody living and understanding and being able to account for the risks that live there with that person. Those are places that we can start to really code the right way and understand the full gamut of risks associated with our member. So those things happen when we have the in-person discussion, and all the better when we have the in-person discussion in the place that person resides, if possible. Man, access and simplicity, we're beating the right drum here, but a couple others that I would look at on this are I mean, certainly empathy, that probably plays a part in any of these measures. But in particular with those people that in particular have not made an annual wellness visit or have never had that interaction with us, just sort of understanding where they're at, but then also leading them with authority to say, by doing this, you increase your likelihood of, and whatever the data is that we want to include that we feel would be compelling, but that ability to establish trust through authority can really help tip the scales and get someone to take that action. So it's one that's worth including as a line or two, or at least testing it out as a line or two within your comms. Drum roll for high value action number one, probably not a surprise to people who are guessing ahead. Condition management programs. This is such fertile ground for so many reasons that we'll get into. But if we start at just kind of the headline and the cost side of it, this is no surprise. And we can look at the stats up, down, and sideways of 6 in 10 adults in the US have a chronic condition. 40% have 2 or more. We know when we go back to well child visits that that's actually feeding into some of these rates going higher and higher. No secret here. This is where we have the biggest cost opportunity in terms of med adherence, in terms of lifestyle, in terms of general attention to one's state of health. And this can also go into things I would even look at as cancer screening. So not necessarily chronic lifestyle, but things that we know are preventable from becoming much, much larger. So the STAR and HEDIS measures around this, and a little small to see here, but if we, I mean, pick your high cost condition, and if that's musculoskeletal issues, if that's diabetes, if that's hypertension, all of these are going to have specific measures that if we write correspondence and say, let's focus on getting involved in, this diabetes management program, we can absolutely go to bat for. It's going to influence these STAR measures, which is going to influence our bottom line. So no other way to split it except for the more that we really focus on this for the right person at the right time, we know that there's a financial yield waiting in sort of the payment mechanisms behind the scenes. This is also one of the most creative and interesting and kind of like, frankly, fun from a communications perspective, because so many health plans now have kind of their like highest gloss and concierge feeling partners might be associated with condition management. So maybe there's a really interesting startup that you're working with that has an incredibly high user satisfaction score. Or maybe it's something that you developed in-house and you just have great connectivity between people living with those conditions and participation in this program, but it can kind of be your place to feel like a concierge service. And as long as you're writing those correspondence with contextual awareness around this is a person who is by definition living in a more challenged state of health, then we can sort of open those gates to let us help you and let us be here for you. Let us present that exclusivity that you only get with our health plan and our partnerships. It can be a really cool place to bring a huge impact to someone who opens this up and says, wow, there's a lot here for me. Pretty hard to say no to at least giving a call or scanning a QR code and getting involved. So that is our top 7. We talked through portal reg, well child, ED avoidance, find a PCP, mail order, wellness visits, and condition management. This is not to say, again, that these are the be all end all, but they are ones that we absolutely know empirically they're going to have a drive right to the bottom line if we can notch up that participation in just a little bit. And so where I sort of go in just the last sort of 2 slides here is how can we help? When I think about all of you as communication or experience experts and specialists, you have a whole gamut of tools and arrows in the quiver that you can and should be using in sort of a multi-pronged approach to driving people to take action. We know that it takes a lot of touches. We know that certain people respond to text, whereas others to email, whereas others to direct mail, and others to billboards. So you've kind of got to have all of that. what I'd argue is that when we look at all of these pieces of correspondence shown here, member guides, explanation of benefits, ID cards and letters, and so on, it's an underrepresented opportunity from the engagement standpoint. And so to start really peeling back the onion and saying, it actually does matter what our EOB looks like, because it can either look like an Excel spreadsheet, or it can be something really visually impactful that is also driving a person to a relevant resource based on the service that they might have just had. So all of these things are, I think Clarity would argue, when you're thinking about that full gamut of tools you have, how hard are you really squeezing on these 150 million touch points that we know as an organization we're sending out every year to make sure that they're driving that actual member engagement and tipping the scales to people taking some action. So again, we for folks who are joining this as a first webinar, very much by design, these are not pitches, but we do want to let you know from sort of the tail end of these where at the very least, where we can be partners, or wherever your current print partner can actually help you in this space, even if it's not Clarity. So we would really challenge people to go to whomever you're working with and say, hey, what's my ROI on those EOBs? How many people are actually registering for something based on receiving those? I think that's the question that really ought to be asked. So a little bit of housekeeping here, and then for folks that have questions, there is a Q&A section just in the Zoom that you can drop questions to. But kind of a parting gift, two places that we've had that first conversation with health plans. One is we love to just take a look at what the current state of letters, EOBs, member guides look like, and have a discussion around, what if we put some of the best behavioral economics principles into some of those letters? What might those look like? They can be a nice way, at the very least, if you've got your monthly meeting with colleagues and want to bring a fresh idea, you can bring something real and visual into those, and it can kind of initiate the discussion. So happy to do those consultations and mock-ups if anyone would like those. The other thing that we've developed, which is just kind of a fun way to make this real for different people within your team or your organization, is this engagement ROI calculator. So if you wanted to say, hey, what if we upped our portal registrations by 10% this year? What kind of a financial value would that give back to us? We've got a calculator that you can just play around with the numbers, have some fun with it, and really make the case that, again, whether it's your email, text campaigns, print modalities, any of those things, you've got to be focused on everything that touches a member has to have some strategic cohesion around driving action. And this can be a really fun way for people that might look at that as all sort of soft value and put some numbers to it and make it a harder value. So you'll see the email here, contact us at clarityssi.com. Happy to get either of those for you. So with that, we've got a few minutes. Why don't we take questions? I think I'm going to be reading them from a chat here. First question is, are there concerns with steer and care if adding a provider name? Concerns with steer and care if adding a provider name. I think we're going back to the idea that if we include a PCP's name on a letter, that we've got a higher likelihood of uptake. And marrying that with steerage, so interesting question. I think we can offer something without prescribing it. And so we could say Dr. Stevens has availability for new patients and lives within 2 miles of your zip code, kind of a method. But to see all of our care providers, you can use the Find a Doc app within our portal and register here now. So, if there are concerns, that's a little bit more of a question to kind of look at internally. But I think with a lot of these things, the way we manage it doesn't have to be something that is overly driven at steerage as much as it's overly trying to extend the idea that there is a real person who's waiting here to see you, and that's available for them. So I think that's more of the dot that we're trying to connect there. Okay. Caitlin, I know you're fielding questions here on the background. I'm not sure if we've got any others. Okay, good. This is actually great on timing. We can give just a few minutes back, but again, my couple leave behinds, happy to share calculators with you, happy to do mockups for you if including some of these principles into your correspondence is something you're interested in, and just kind of seeing that as a freebie. And the other one is, man, we have got great insights over the past year on these webinars. We've brought partners into different ones to sort of have subject matter expertise. So check out clarityssi.com. Again, it's the Insights tab is where you can download or view any of these previous webinars. So thank you all so much. Happy Thursday, and we will look forward to talking to you next time. Bye-bye.